Ashley Turner tragically lost her brother to fentanyl poisoning in 2021 after it was revealed that system negligence was a strong contributing factor to his demise. Ashley and her family made it their mission to bring change to how people who use drugs are treated in Saskatchewan, and they've had some success. Welcome to the Friday Morning Freestyle. My name is Dan from the Hard Knox Talks studio. Hey, Ashley.
Hi, how's it going?
Good. Let's jump in. Let's talk about a little bit about what it was like growing up in a family affected by substance use. Now, you mentioned it started as early as grade 4 for you.
Yeah, I'm the youngest out of the four of us. I grew up with 3 older brothers, so you can imagine how hard I had it, and just in general, taking out the addiction part from it. Shane was 3 years older than me, so we were very close.
And Shane was the brother that you lost.
Shane is the brother that I lost, yes.
Yeah.
I would have been in grade 4 when Shane would have been in grade 8, and that's when he, started using substances. But before that, life was very beautiful growing up with Shane. He was very, full of innocence, as most people are as a kid. No one is born wanting to be an addict. No one is born wanting to use substances. No one is born wanting to die at 31 either, which he did. It was chaotic. I idolized Shane my whole life, even still to this day. His humor.
You looked up to him
my whole life.
Did he offer guidance and
Yes.
life lessons? And
yeah,
he was a good human.
Very good. He was very protecting. Even if he wasn't watching my back, somebody was that knew him. He always had people looking out for me. He was always looking out for me. He could mess around with me, but no one else could.
Sounds about right.
Yeah, he was very loving as a person. Yeah, we were very close growing up. My core memories begin with Shane. I look back at my life, and when I can, like the beginning memories that I have of my life, he's in every single one. He was the one that, when I was scared, I'd crawl into his bed. He was the one that was always babysitting me. He was the one that, loved me fully and always had my back, even as we got older. But
was there conversations around substance use in the home at that age?
Well, I was in grade 4, so I was a little bit young, but my memories kind of consumed with visiting my brother in detox, visiting my brother in rehabs across Saskatchewan. It was a lot of watching my parents really fight for my brother to get help and really trying to love him through it and figuring out what his options are and what his resources are. And the thing I've learned, as I'm 29 years old now and lost my brother 2 years ago almost, that the drug crisis, when it started in 2004, when I first acknowledged that it was the thing, obviously I was really young, but I watched the drug crisis grow through my whole life, but I've never watched the resources and the funding grow with it. It stayed the same, but the drug crisis got bigger and evolved, but the resources from 2004 to now seem to be the same.
Yeah, and even with the growing conversation around these challenges, like it's gotten very loud over the past couple of years, and it continues to grow. But you're right. I mean, we have promises of more beds in Saskatchewan. We have talk about addressing the homelessness crisis in Saskatchewan, but there's no more funds coming in, so there can't really be much more boots on the ground.
And I remember growing up watching my mom on the phone, calling detoxes and rehab centers across Saskatchewan and begging, a bed for my brother. And it was the same answer. There are no beds available. And the day that my brother died, it was the same answer. There are no beds available. Why is it 10 years later? Because it's been 10 years now since I've stepped foot into the addiction crisis myself, watching my brother struggle for it. My brothers, actually. And it's still the same answers. Why are we still having the same answers?
I'm interested to know about the dynamic, about like your parents. Did they know about substance use disorder before Shane? Were they versed in it at all?
No. And
like this must have been like a blindside, like, holy cow, how do we handle this? And how did they handle it at first?
It was, it was tough to wrap your head around, right? If you're not educated on it, and I fully didn't educate myself on it until my brother had passed away. I've always been my brother's keeper. As we got older, the roles kind of reversed, where I was out on the streets looking for him and protecting him and going into trap houses to find him and finding him on the streets. And,
Did you judge him before you knew what you know now?
I was mad. I didn't judge him, but I was mad. I remember like take my brother to the hospital, the Pasqua hospital, because I drove him to a meeting and I went to pick him up for the meeting. And, you know, instead of being at the meeting picking him up, I was picking him up at a different location. And I could tell he was under the influence. So I'd get so mad because I'm like, I didn't understand it. And I remember being on top of my brother in this hospital bed, trying to shake it out of him, you know, being like, why can't you change? Like, what is it? I didn't understand it. And it was actually a year before my brother passed away where I finally accepted the fact that he was an addict. You know, at first you're embarrassed of your brother because you hear all these things, and then you're reading articles on the criminal parts of the things that he was doing when he was in the media because of the criminal aspect of things he did when he was under the influence that he didn't even remember doing. You know, when I talked to him sober after the fact, or
did they shine light on that in the media, that he was under any influence or anything?
Yeah, and that's the part that's the kind of faulting, because then it stigmatizes that people who suffer from substance use disorder are just criminal and deviant. And it leads up to that to this day, with the coroner not accepting our inquest and denying it instead, you know, because he didn't overdose in custody, and he didn't overdose under the government. You know, he overdosed in White City, in the community, which is faulting, because then you're just still stigmatizing people who suffer from substance use disorder as criminal and deviant when that's not the case.
Making bad choices.
Yeah, so I didn't judge him, but I was angry with him because we would talk when he was in sobriety about all these things he wanted to do: be a father, be an addictions counselor, go back to school, make the change in the system, make the change, you know. So
did he have any stints of recovery?
Yes. Yeah. When he wanted to be, you know, the one to make the decision to go to treatment, and when he wanted to be the one to step foot into, you know, whether it was Maxi House or Pine Lodge or Calder Center or go to Saskatoon or Moose Jaw, whatever the case was, when he made that decision for himself and came to us like, hey, I need help, I want to go to detox, I want to go to treatment, you know, and we got him those resources eventually when they became readily available for him. He really did the work. I have journals actually from Maxi House of his, you know, so I finally got to understand my brother after it was a little too late to, obviously, but at least all these questions I had, like, you know, why can't you stay sober? Why are you an addict in the first place? What made you use drugs? You know, what's your triggers? I got to know all those things through these journals. So I know he did the work, and I know he knew his tools, and I know he wanted to be sober, and he wanted to live, and he wanted to be in recovery, you know, but it just had such a grip on him, and there were no resources available for him when he wanted them.
Did you guys ever try to force him into treatment?
My mom more so, yeah. But as a mom, you know, you just want your child to be sober and live in recovery, right? So, yeah, there were times that, you know, she would be the one to push him into treatment, and you know, I think he went because he loved my mom so much. Like, my brother's a mama's boy through and through. Like, you know, it was always those two together. Like he you know, they say there's no favorites, but I'd have to disagree. I think he was the favorite, and rightfully so. You know, he deserved that for sure. He was, you know, he was the glue of our family. So, and it hasn't been the same since he's been gone. So that's a huge reason why we've advocated and everything leading up to him the way that it is. Like, we knew that there was some faults in that. So
when he was accessing services, when he was in treatment and detox and all of these things, and I'm talking about the times where he went willingly, he completed the programming
sometimes.
And then what was it that took him back out? Because I mean, obviously we can talk about system failures and like the lack of aftercare, the lack of programming. Was there anything specifically that you noticed with him that always took him back out?
Yeah. There's factors, you know, there's the friends, the people you surround yourself with, you know. A lot of it was trauma, boredom, a lot of wanting to be accepted, you know, and I don't think he could find like the right foot to feel accepted as someone who's sober, as someone who's in recovery. He always had one hand in the gang life and the criminal life and the substance use life, and, you know, friends that were still in active use, and then friends and even family that were still in active use. And, I don't think he could really wrap his head around the trauma that he experienced growing up as well, so I think that played a huge part in like accepting what had happened to him growing up and, accepting, I feel like since he used for so long, because he was, he started using in grade 8 and he died at 31. If you do the math, that's a long time, so to find a life outside of that I think was really the most difficult part for him. He didn't know.
And the most important, really, I mean, obviously it's important that we make these changes for ourselves at some point. Like sometimes it can be, I need to get sober for my job. I need to get sober because I want to be a parent or whatever. And that can work in the short term. Right? That can give us that motivation. But in the long term, we have to find some other meaning in our life.
Right.
Right. And that's really challenging if we don't have anyone guiding us.
Yes.
So tell us about the situation leading up to his passing. How did that play out?
He was released from custody after a year being incarcerated for something that he committed when he was under the influence. The crazy part is I remember I took 6 months away from talking to my brother when he was incarcerated because I didn't understand. I was, again, really upset and frustrated. So I took some time apart. And, that's like obviously when, someone passed away that you love so much, it's your biggest regret. You wish you could do it all differently. Right.
Yeah.
And I think about it all the time. But, when my brother was incarcerated, we talked every day on the phone, and, I just, it's one of my biggest regrets. But he was, when he got released, it's the best I've ever seen him look. He was thick and he looked healthy and he looked like he was ready to start his life. I had just been home for a week. I was in school in the States and I came home when he was released. And that was October 30th. He was released and he took his kids trick-or-treating on the 31st and I got home on the 1st. And the morning of the 2nd, I hugged my brother at the top of the stairs. He was going to meet with social workers in regards to his kids. And I hugged him goodbye and I told him I loved him and I would see him later. And that's the last time I see my brother alive. And then he didn't come home that day. And so my mom and I kind of knew, that he probably went and hung out with people and obviously relapsed. And we kind of were suspecting that, he was starting to use on the 1st anyways. We kind of seen the signs, like we've been dealing with it for so long. And
when he was released, was there any services being offered to him, any guidance being offered to him or to the family or anything? This is what you can expect. This is what we recommend you do. None of that. Just here's your bag of clothes. See you later.
Yes.
And they knew when he came in that he was struggling with substances.
Yes.
Okay.
And that's what I was wondering too, as like time went on and I started coming out of the shock of it. I was like, what happens to people that don't have family to pick them up? Where do they go? Where do these people go? And then I started to see like why there's such a cycle of people being released and then being back into the community and then being back incarcerated. It's the cycle. You're taking these traumatized people and these people who suffer from substance use disorder and you're throwing them back out into the community with no resources or lack of them. And, then they're re-traumatized all over again because they literally don't know where to go from there, and then you're just, the cycle continues and there's no rehabilitation in that, it's reincarceration over and over again because there's lack of resources, readily available for people who exit those prison doors. Where are those resources? Why are there none?
As far as I know, and maybe this has changed, but they don't even offer help with like things like getting ID or securing housing or maybe finding some employment or things like that. Things that aren't inherently ingrained in someone who's been struggling or living this life for how long? 30, 20 years?
Yeah. And that was my brother just being incarcerated for a year. What about people 5 years, 10 years? And that's a lot changes in society in a year, let alone 5 to 10 years. People don't know what's going on. People don't know where to go. People don't know what to do, And the one thing I could say is that like, Jenny Churchill with Mom Stop the Harm, she couldn't have said it better that when she said, there's help if you ask for it, and that's what she would tell me. But she's like, you couldn't be more wrong. There's no help if you ask for it. There's lack of it, if that. So that's really something that has stuck with me, in terms of my brother and what happened to him, and then what happens to everybody else. There's no help if you ask for it. And that's proven. There's been deaths to prove that, not even just my brothers.
So continue on with the circumstances that led up to his death.
So on November 7th in the evening, he experienced an overdose in White City in a hotel, in the lobby, where he was staying. So luckily, people seen it happen. So they called the ambulance, and he was taken to Regina General Hospital at 7:15 that evening. So he was not coherent. He was not awake. He was suffering, right? And so they admitted him into the hospital that evening, and they put a tube down his throat to help him breathe. And in the morning at 5 a.m., he was able to spit the tube out himself, and he became coherent. He did not become sober. He was not aware. He was just awake, but that was at 5:15 in the morning. And the first thing he asked for was detox. He wanted detox. That's one time. He asked detox to the doctor on call, the emergency doctor on call. He asked for detox. It's noted in the patient advocate report, patient requesting detox. Again, patient requesting detox. Nurses, patient requesting detox. Patients asking for detox. Addiction counselor, patient requesting detox.
And
7
these are all
times.
separate forms by separate professionals.
It's a patient advocate forms that my mom did after my brother passed away. When we found out the events leading up to his death and how it happened, we knew we figured out that the hospital was involved and he was in the hospital. We requested those patient advocate forms, and in there it says 7 times to addiction counselors, to nurses, and to the doctor. Within a 4-hour period, my brother had requested, cried, and begged for detox 7 times. And I emphasize the 7 times because he should have only have had to ask for one time. That's all it should have taken for him to be going from Regina General Hospital into detox briefing. One time.
So something's come to mind here. Let's take a step back for just a moment. When he was incarcerated, was there any programming available to help him move forward through his substance use challenges?
No, my brother was in actually, the last month that he had in jail, he actually requested to be taken out of the unit that he was in because he didn't want to be a part of that unit anymore. He knew he had a month left and didn't want to get into any trouble that would, extend his time.
Was he using in jail?
No. As far as I know, I can't speak on what went in between those walls. We do know some other stuff as he came out, obviously, more the in-depth within the prison system and how corrupt it actually really is. But as for him using, I say no, because when he came out, he looked very well and he looked healthy, but I don't know what went on in between those walls,
So he's asked for detox several times. What was he met with?
So an addiction counselor met with him at 8:30 in that morning, and he was told that he did not meet criteria and that there were no beds available for him. They gave him a pamphlet to social assistance for financial support, which he did not ask for nor request. And he also got a pamphlet on how to safely inject, and a cab voucher. And in the patient advocate report, they say that he was very polite about the situation, which, what other choice did he have? Because it's been proven prior to my brother's death that even if you fight, even if you scream, even if you make a scene, the result's the same. You're still thrown out. You still got to go. You don't get to stay regardless of how you play it out. So whether you're polite about the situation or you make a fight and you make a scene, you're still getting thrown out of that hospital. You just have a choice to walk out or for security to throw you out. And that's your options.
Was the family involved with any of this at the time? Like when he went into the hospital, did you show up, or?
Due to privacy acts, they don't call.
Yeah.
And that's flawed. And it's, because I honestly envy the doctors and the nurses and the addictions counselors, because they're the last people, some of the last people to see my brother alive, because my brother was discharged at 9:15 in the morning and he died that same day from a second overdose and fentanyl poisoning. The only time the next of kin gets called is if they're showing up in a body bag, not if they're incoherent, not if they're suffering, not if they're sick, not if they're not able to make the decision to call. You know, that's when they call you.
So what was the experience of being notified? Was there, at that point, here is some information on how you can get some help working through this?
You know, the most ironic part, when I got the call, so a police officer showed up to my mom's house. Given the fact that he passed away in a hotel room, you know, there was identification and there was his belongings to identify who he was. They told my mom first. I wasn't at the house when they told my mom. I just remember getting the call, and I could hear to my mom's voice, you know, that something wasn't right when she had called me. And I'll never forget the tone of her voice. I've never heard it before. And she had said that I needed to come home. And I needed to know everything, because I would have just sped the whole way home and I'd be all over the map. So I was like, I'm not leaving like this parked spot, because I was in my car. I was like, I need to know, like, why am I coming home? Like, what's going on? And she was like, well, it's Shane. And I was like, oh, my first thought was he got picked up. He's going back to jail. You know, like that was my first thought. And like, that's when I realized, when I look back at it, that how stigmatizing I was, you know, to expect that my brother was just going back to jail because he must have used and did something, you know, like he always would, was my thought. But I didn't know any better. And then she said, I was like, oh, he got picked up. And she said, no, Ashley, he didn't get picked up. I was like, okay, then he's in the hospital. And she said, no, he's not in the hospital. And, you know, I was like, he died. And then she's like, there was no reassurance in that, you know, there was no like, no, he's okay. Like, this happened, you know, it was silent on the phone. And if silence could talk, it did.
It does.
It did. Yeah. And I didn't even know what to say. I hung up, actually, because my whole life changed, you know, in that second. Oh, sorry. Still heavy to hear and to say out loud.
Why don't we take a quick break and hear from today's sponsors?
Ooh.
We've watched our children walk away. We've felt hopeless, powerless. We are moms. Stop the harm. We are not hopeless. We are not powerless. Stronger Together Canada is a national network of peer-led support groups to help navigate these challenges. If you're coping with a child's substance use, reach out to www.holdinghopecanada.org. If you've lost a child to drug poisoning or overdose, www.healingheartscanada.org. We're here to help, and we are stronger together.
Okay, today's episode is also brought to us by Possibilities Recovery Centre, Saskatchewan's only private outpatient addictions treatment centre serving Saskatchewan from their Saskatoon, Saskatchewan location. The Elizabeth Fry Society of Saskatchewan reminding us that housing is the only proven strategy to break the homelessness to jail cycle. And Prairie Sky Recovery Centre, Saskatchewan's only private inpatient addictions treatment program located in Leipzig, Saskatchewan. To learn more about today's sponsors, check out our new merch, or if you want to if you want to buy us a coffee, all of those links are in the show notes below.
Okay.
Ready?
Yes.
Okay.
And then, and then I went home and, you know, again, stigmatizing myself and how I viewed it. I was like, oh, my brother overdosed in an alley, or he overdosed in a house, or
let's be real though. I mean, it's with the experiences that you've had, you know, and not having the education that you do now, I don't think that it's unfair for you to think those things at that time.
Yeah.
Would you agree?
Yeah. It's just heavy to think of it like that, you know, because the version I was before my brother passed away, like, she's long gone, you know, I'm not the same person. And all my friends changed as I maneuvered through my grief. And a lot of people won't support the advocacy part of like what I'm doing for the community and what I'm doing for future generations and for the generations currently suffering from substance use disorder. So a lot's changed since my brother's passing, my friends, me.
When did that change start? Obviously, there was a grieving process. I think that's safe to assume, where the family sort of came to terms with what happened. How long did it take you to start? I mean, was it anger that came in? What was it that came in that motivated you to start trying to make change?
Well, I started realizing my resilience when I was like writing my brother's eulogy and planning my brother's funeral, picking out what he was going to wear, doing the viewing and planning everything so that my parents didn't have to, because I mean, who really wants to plan that, right? Like for their child. So I was trying to take on as much as I could, all while being a mom at the same time, and a good mom, and that's the hardest role I've ever had to play. So I started really realizing my resilience, and I never got angry until I realized how preventable his death was, and how preventable, anyone's death is really. Anyone who suffers from substance use disorder, their deaths are preventable.
So hang on now. So was there, when this first happened, was this like, Shane, how could you?
Yeah.
You were angry with him?
I wasn't even so much angry. I wasn't even angry with God. A lot of people turn to God and they get so mad and, they shout, why me, and why him, and I wasn't, I lost my first best friend, and I'm a forgotten mourner being the sibling. A lot of it goes to the parents. So I definitely kind of felt like I didn't really have a lot of people to lean on, and especially in terms of like my friend groups at the time. Like I think they expected me to like go through a few motions and then be over it and move on and be the same person. So, but that wasn't the case. It's never the case. And I think they expected me to find peace in it also, but it's been 2 years and I still will never find the peace in why my 31-year-old brother was turned away from the healthcare system when he was suffering from, an overdose and leaving the hospital that day. Like he had a choice, either to read those pamphlets and take it into consideration, but after just suffering from an overdose, you're going through withdrawal, which is just as life-threatening.
That's the thing that I've said so many times, and like, I've experienced that stigma myself. My wife Donna, she's experienced that stigma herself, where you're expected to somehow act well before you can get help to act well.
Yeah,
it's very strange.
It was strange. And the most ironic part is when I went to pick up my brother's stuff from the hotel room, because they put his stuff in a box and you have to go pick it up. It was on top of that box. The 2 pamphlets from the hospital were sitting on top of that box, and my brother had the number circled, where to call. And like he was wanting to do the work, he was wanting to see, but he didn't need financial assistance. He didn't need financial assistance. He needed medical health care. And in the advocate report and in the letter that we received from the doctor that was on call for his case, had said, well, we provided him with those 2 pamphlets. Is that as good as it gets? You leave the hospital from someone who just suffers from an overdose, and you get 2 pamphlets, and that's your resources. Yeah. I mean, really. And so that was really frustrating to read, and that's how we figured out actually that my brother was in the hospital. Was from those 2 pamphlets, because we're like, where did these 2 pamphlets come from? So we started doing the work, and then when we had to meet with the coroner, he had told us that my brother was in the hospital the day before he passed and was discharged the day of. So that's when we really started getting the foot on the ball. And I want to express my gratitude to Jenny Churchill from Mom Stop the Harm, because she was the first to be there for us. She was actually probably one of my first texts when my brother passed away, because I've been talking to her for a year previously on my brother.
I've had a lot of good conversations with Jenny.
Yeah. So she was, I extend my gratitude and my love to her completely, because she's definitely helped us maneuver through not only grief and everything else, but through the advocacy part, through the coroners, through everything else that we've done. Like it wouldn't have been as big as it was without her.
No, I've asked Jenny to come on the show more than once, and she's like, nope, nope, I gotta do what I do quiet, so you can do what you go ahead and do what you do loud. I'll do what I do quiet.
Yeah,
So,
but even her silence is powerful,
it
you know.
absolutely is, and I'm starting to understand it now. So I'm starting to get it, Jenny. If you're watching,
Yeah, honestly, yeah, she's an angel, you know. And one of the things that bothered her the most too, even, is you know, my brother never got an naloxone kit leaving the hospital, which is something that she implemented for her son, you know, for that to be implemented into the hospital. But my brother never got one leaving the hospital, which is baffling to me, actually, that he never received one. But there's a lot of things that added up to my brother's death. You know, even to this day, I have nurses from the hospital, and I have people who work in the detox facilities and the rehab centers messaging me, being like, wow, like they dropped the ball, Ashley. Like, you know, your brother could have came to our unit, or he could have been admitted for a medically supervised withdrawal. Because when we called the detox center to even find out if there was a referral made on behalf of my brother, they told us no. No one called on behalf of my brother that day, but they said if they had kept my brother in the hospital for a few more hours that day and just admitted him or kept a closer eye on him for a little bit longer, a bed would have been available for him that afternoon.
And that might have been the time.
Yeah. And I, you know, and I, through my advocacy, I had people tell me, like, they'll message me and be like, oh, if you play stupid games, you win stupid prizes, you know, and if your brother made the choice to use, you know, and all these things.
Still,
and then,
but you're hearing that.
Yeah, sometimes it's not as popular as it was in the beginning, you know, but I would get so mad. I swear I'd be messaging Jenny and be like, I chose violence and this is how I responded, you know, this is how I responded. I'm like, you know, and I'd be like, you know, I'd be in their faces. But now I use it as like an educational opportunity to be like, and I'll creep their profiles and I'll see that they have kids and grandkids. And I'm like, you know, the one thing I could say to you full-heartedly is that I would never want anyone to go through watching a loved one suffer from substance use disorder, because it's literally the one thing that you can't change. You know, it's literally the one thing I could not change for my brother, no matter how much I loved him, begged him, cried, anger, whatever the case was. You know, I got to the point where I wanted to lock my brother in the house because I just didn't want him to leave, because I didn't know if I was ever going to see him again. You know, and I didn't know if I'd ever find him again. And I was searching the streets all the time for him. But the one thing I say to people now, after seeing if there's kids or grandkids, I'm like, you know, you might not get it now, and I hope you never have to, but, you know, God forbid it happens to someone you love. I'm trying to make sure our future generations and our kids and our grandkids have these resources readily available for them if they need it. You know, I don't want record-breaking years every year anymore. You know, I don't want the deaths to increase. I want it to stop. You know, I want resources readily available for people who want them and need them, you know, and that's what I tell people now. You know, I use it as educational purposes, and I really express the fact that I'm trying for our future generations, and I'm trying for our kids, and I'm trying because we have kids dying from the drug crisis now, you know. Well, there was just kids
recently in the news a family of 3, including I believe an 18-month or a 16-month-old child.
Yeah.
Died of fentanyl poisoning.
Sad.
Yeah.
You know, it's sad. And, you know,
like here in Saskatoon.
And there's no such thing as recreational use anymore. You know, it's a game, life or death. And that's the point that the drug crisis is at now, is that you don't know what you're taking. You don't know what's in it. You simply don't know. For
anyone who might not know, now your brother passed of a drug poisoning. How is a poisoning different than an overdose?
So for him, I know my brother wasn't a fentanyl user, so I knew when he had fentanyl poisoning in him that, you know, it was an intentional use of fentanyl. So for him, like, the poisoning, when the coroner explained it to us, was that there was enough tranquilizer and enough poisoning in his system to take out an elephant, and that's how severe the amount of drugs in his system were. The one thing I'd asked him, I was like, did he, you know, was he in pain? You know, did it hurt? And he said, no, it would have taken him out in like 30 seconds. And like, that's my brother's case specifically. You know, that's his toxology reports. That's, you know, that was his body. You know, that was how it was for him. Took him out in 30 seconds. They didn't, and they said naloxone wouldn't even have reversed that. it's so immense and it's so powerful with the tranquilizer and the sedative now that it's enough to take you out, without even having anyone having a chance to even revive you. And that's a complexity of it now.
So you mentioned before that you've actually managed to foster some change with your advocacy in the system. Why don't you tell us a little bit about what changes you've been able to put into play?
At first we had asked for an inquest. We wanted an inquest for my brother because of what had happened to him, but it was denied by the chief coroner of Saskatchewan. He had said that since we advocated through the Legislative Assembly, that we did the advocacy part of it, and that since his death was labeled accidental, that there was no need for an inquest because we knew the cause of death. Again, which I think is severely flawed.
Why is it flawed?
It's flawed because it's stigmatizing that, as of our knowledge, there's no inquest that has taken place in Saskatchewan for an overdose that has taken place in our community. It's always taken place if it's in custody, which stigmatizes criminal and deviant. That's what people who use substance use are. They're criminal and deviant. So it would have changed people's perspective, and it would have spread awareness. Okay, so this is not only just occurring in custody and under government supervision, it's occurring on the streets and it's occurring in our community, and not everyone who suffers from it is criminal and deviant. And it's, if we took the focus from the prison system and the incarceration part of things, they're not just criminals, they're not just deviant, they're not just
and if they are committing crimes,
it's because
that's a symptom of behavior, or
yes.
That's a symptom of disorder.
Do you know how many times my brother is going to jail and he'd be like, I don't even remember what I'm going to jail for, Ashley. Like I don't remember doing it. And so when I see him in sobriety and he was going to jail for something that he committed when he was under the influence, it was really complex because he went to treatment for 3 months and and he was doing all this work, and now the prosecutor is sending him to jail or to prison because in between the time between his court and the time that he was going to jail, like they're throwing him back in, but they're throwing him back in sobriety. When he did the work for the last 3 months to remain sober, got a job, was working with social services to get his kids back, had the kids. Now they're just throwing him back in.
Throw him in jail.
Yeah. So it's almost like it's built to fail, and that's why I always say that our system is built on temporary solutions instead of preventable measures, because it's flawed and it's broken. And even the tiniest gap in our system and the tiniest chain broken in our system, the whole thing will fail. And it's done just that, not even just for my brother, but for everybody else, that needed the system and needed they needed the medical help, and they never got it. Since when do people who suffer from substance use disorder forfeit their right to equal health care? When do they forfeit that right? And that's a question I'm still trying to figure out 2 years later. And that's a question I ask. I've asked the Saskatchewan Health Authority. I've asked the Director of Addictions and Mental Health. I've asked Minister Hindley. I said, when does this end? What are you doing? Are you looking at these numbers who are actually people and loved ones and brothers and sisters and mothers and fathers and cousins and significant others and friends, and have people that love them and don't want them to die, and they don't even want to die? Are you looking at those numbers and are you accepting death? Are you accepting tragedy? Because that's all I see when you're not implementing resources and you're not implementing the funding where it's needed, and you're not listening to people who are organizations and nonprofits and people who are suffering from substance use disorder. You're not listening to them. You're not hearing them because you're not implementing what they need. You're implementing forced treatment and forced treatment centers when no one said that that's what they wanted. That's not what anybody said that they needed. All you're doing is a way, you're not taking the view from incarceration and jails and putting it onto what really matters and what they actually need. You're just looking to where you can make money. You don't think coercion will work then? No, I don't. I think it's flawed, and I think it's a broken strategy. I think this because all you're doing is putting incarceration on treatment beds. That's all you're doing. You're not. They have to want to go. They have to want to be there for it to be effective, and that's my opinion. And that's just from my experience of seeing what worked for my brother and what didn't work for my brother. And when my brother went into treatment without wanting to be there, and only was going because the kids asked him to go, or because I asked him to go, or because my mom and dad pushed him into it, didn't work. I really see my brother do the work when he was like, I need this for me. I need this because I want this. I want to be sober. I want to be in recovery, not because my mom or my sister or my kids want it for me,
So what other changes have you helped foster?
Well, when we met with the chief coroner, because I had pushed back for a meeting, because when he emailed us and told us that he was denying the inquest, and I had told him that's flawed. It's not okay. I don't agree with this decision. I'd like to set up a meeting and discuss this further in person so I can have an understanding as to why an inquest is denied, which would be the change. It would help start conversations differently, change perspectives, so I really pushed back because I know Jenny had told me from the beginning, there's a lot of no in advocacy. Be prepared for that. It's going to feel defeating. And it almost was defeating to hear no, because you want it so bad and you want it, you would expect it to happen. You have people telling you, oh, this is going to be the one that the inquest is approved for, because he was thrown out of the hospital when he asked for it 7 times, he asked for help and he died in the same day, so you would just, and I asked him, I said, what other criteria needs to happen for someone who suffers an overdose in our community to gain an inquest? What other criteria needs to occur? That should be more than enough. He just had to explain the purposes of, my mom and I and Jenny had met with him a few days after he denied the inquest, and we met with him and he had discussed just the purpose of an inquest. We did the advocacy through the Legislative Assembly. We, that stuff already took place. It's already been publicly aware, through the media, because Global covered it, CBC covered it, Leader Post covered it. So it's already out there, and so he's like, the point of an inquest is for that, and it's to know the cause of death, but we know Shane's cause of death. But we didn't know everything. No one knows everything leading up to his cause of death, though, and how the system played a part in that cause of death. Because who's to say my brother wouldn't have passed away a month from then, but either way, that particular day, there were so many people that could have prevented that from happening. There's so many people that could have listened and said, okay, he needs this help. So, yeah, and so we met with Jenny, and Jenny had suggested to him that he does a press release in my brother's story on it, and with his recommendations, because he did offer 2 recommendations for the Saskatchewan Health Authority to make sure that what happened to my brother doesn't happen again, to review their protocol on naloxone kits, and also to have something in place to take someone from the hospital into social detoxing right away, so there's no gap there. And so he came out, thanks to Jenny, a week later, or a couple weeks later after Christmas. It was the beginning of January of this year. And he held a press release in regards to Shane and what happened to him. And that's the first time that's ever happened. So that was a huge win for us, thanks to Jenny with Mom Stop the Harm. She implemented that for us, and we couldn't be more thankful, because that was
showed up too. Let's take a minute here.
Yeah.
You're always, oh, Jenny. Yes, oh, Jenny.
Because I love her so much.
But you showed up too.
I did.
Like, let's take a minute and honor that.
I did.
You worked your ass off, and you continue to do so.
Yeah, I pushed back for that meeting because I have a hard time in general taking no for an answer. I like to turn them into yeses, because, I feel like, in terms of my brother, that was flawed, and, he deserved better than that, and he deserved to be honored differently than that. And so once I started figuring out what really happened to my brother, and really reading like the patient advocate reports in the hospital, and how many times it was preventable within even in him 5 minutes awakening from an overdose. And so, yeah, he held that press conference, and it was the one thing that signified a huge change. It got us a meeting with the Saskatchewan Health Authority. It got us more meetings with Minister Hindley, because Minister Hindley at the Legislative Assembly last November had said that he would be following up with us. It took him 3 months to follow up with us after what happened to my brother. He said he was going to look into it. The only reason why it followed up is because I had mentioned on Global News that he had not followed up with us yet. And then we were invited, my mom and I, to a meeting with the Director of Addictions and Mental Health, which Jenny attended with us as well. And she had told us that these the recommendations from the chief coroner were already being implemented into into the hospital.
And the changes were
to have it where if you're requesting detox from the hospital, that you'll be directly admitted into social briefing or into detox. So there is no gap. There's no, if you want detox, it's there for you. It's readily available for you. And to review Noxalone kits also.
Now, is this Saskatchewan wide or is this?
This is Saskatchewan wide, yes.
Okay.
And we met with her. Again, she offered condolences, something we've heard from government and people of power and authority throughout the whole thing, but we don't want condolences. We want change. We want implemented. Condolences doesn't make changes. You know, it was appreciative. It didn't feel genuine. It felt like there was a lack of accountability for the part that they played in it. You know, she had mentioned that she had talked to the addiction counselor who was on my brother's case, and that an electronic referral was made on behalf of my brother, which again is still a lingering thing for us because there's no one to confirm that electronic referral was made. A few weeks after my brother had passed, we had talked to Detox. They had told us that there was no referral made on behalf of my brother, and that I'm assuming that would mean an electronic one as well. So in terms of that, that's changed now. So now when the addiction counselor gets to the hospital in the morning, they have to call the detox center. They have to make a phone call and talk to the person at detox and ask how many beds are available, connect and see where they're at throughout the day. So now there's no more electronic referrals. You have to call. So that was a huge one because I felt like that was a huge gap because it's still a lingering question to this day that's unanswered is why there was no referral made on behalf of my brother to call detox. Why did no one call? You know, so that's something that has changed. Another thing has changed is if the person requesting detox wants to give a next of kin, it's for them to call if a bed becomes readily available for them, or if they want something different or something, then they can call the next of kin. A next of kin can be provided. So that changes a little bit of the Privacy Act, where there's no next of kin involved, there's no emergency contact involved, no nothing. So that has changed. You get directed from the hospital straight to the detox facility now. If you're requesting it, you'll go into social briefing and into detox. So that's a huge one that would have saved my brother's life that day. And yeah, the Noxalone kits are definitely important as well, because why my brother was never received one, would be hurtful to someone who really fought for that to be implemented into the hospital. Why they're not following that. What are you continuing to fight for? What would you like to see? And more resources and harm reduction, more government funding, more government support. You know, we talked about COVID crisis for 2 years on the media, and I appreciate that and I respect that immensely. But why was no one coming forward and being like, there's a drug crisis. This is what's happening in our community. Well, you heard little bits of it. Not as much. No, not as much. My wish is that the government would just listen. Someone would just listen to what nonprofits are asking for, what organizations are asking for, what is needed into the community. When in terms of Minister Hindley, like I almost wanted to request a meeting in our community, so he could take a look as to what is needed, or to spend a day there with some of these nonprofit organizations. And I'm unaware if he does or not, but I think if someone did, they would change their perspective on what's needed within our community. And it starts with compassion and it starts with love. And that's the biggest thing that, at first, like I was advocating for my brother, and to honor his legacy and to make him be the change because he wanted to be the change, and so I made him that change. Now I have people messaging me, being like, thank you. Now this person for me is going from the hospital straight into detox, that wouldn't have happened had, and I hate that he was the change, but if it had to be, I'm glad he's making that difference for people. And the biggest thing that we were told that is being implemented, which is huge, is that these changes aren't just a 2-week thing, and then it goes back to normal. There's now an oversight to make sure that these changes are occurring. And we have the director of Saskatchewan Health Authority has confirmed in emails that, this is still happening. These changes are still implemented. We're still overseeing things, and the oversight is the most important part of it, because if these are just changes that only last a few weeks and a month and then they go away, the gaps aren't filled anymore, and it's still going to happen to future people, and it's still going to happen. The same thing that'll happen to my brother is going to happen again, and I'll be damned if I let that happen, and so that was a huge thing for us, and it was a huge win to have. It was 6 in total changes implemented into the Saskatchewan Health Authority across Saskatchewan. So
when you say harm reduction, what do you think harm reduction should look like? What do you think would have saved your brother?
That day, in terms of harm reduction, him going into detox, or at least being admitted into the hospital for a medically supervised withdrawal, because withdrawal is just as life-threatening as an overdose, so in terms of that, in terms of just harm reduction in general, like I work in the community, I'm hands-on in the community. In terms of harm reduction, I'd like to see people with homes. Access to housing is harm reduction. Yep. Having access to clean drinking water and to food is harm reduction. Having access to winter clothing and warmth is harm reduction. A lot of people think harm reduction is safe drug supply, but it goes so much deeper than that. Do
you think there should be a safe drug supply available?
Yes, I do, because I would have rather have had my brother alive and using than to have him die. And because when he died, hope died. Hope died, and now there's silence of the phone. Something you would think that, all the times I get calls at 3 a.m. for him, or calls from jail, like I miss the phone ringing, and at least knowing that he's taking a safe drug supply, if that's it for him, at least he's alive, and harm reduction is so important, and safe harm reduction is important, and I think our government really needs to take a look at how they can implement funding for that, and, support these nonprofit organizations, and to support the people in our community who are trying to make this difference, and to try to help the homeless and
support
the families. Listen, it starts with compassion. And when my brother passed away, I had all this love left to give, so much love. And now I meet people where they're at in the community. Now I give all that love back into the community, and I'm just not talking about I take winter clothing and blankets and food and beverages, and I give them to a bunch of different organizations to distribute. I go into that community, and I love those people, and I show compassion to those people, and I talk to those people, and I let them talk about their life and their experience, and I sit with them, and I really build a genuine connection with them, because that's where it starts. It starts with love, and it starts with compassion, and it starts with hearing and understanding.
Where can people find you?
I'm on social media as Laugh Now, Cry Later. I am out in the community. I'm on Facebook.
What is your name on Facebook?
It's just Ashley Marie, but I post a lot of my Laugh Now, Cry Later stuff through that. I've had people reach out to me on there. I've had people reach out to me on both my Instagram pages. I post a lot of me just talking like this on my stories, so that people know that, like, if you would like to volunteer, if you'd like to work with us, this is like the things that we're doing. We fundraise a lot, like everything that I implement into the community is based on fundraising. Yeah, it's an organization. It's not defined as a nonprofit, but I don't take no profits from anything that
What's
gets
it called?
Laugh Now, Cry Later.
Oh.
Yeah.
Okay.
Yeah. So we do a lot for the community. Everything we do is based on fundraising. So we fundraise a lot. Everything that we get, goes back into the community, whether it's we bring in a lot of mitts and toques in bulk to distribute, blankets, winter clothing, coffee, food. Yeah, this year we have a lot in the works currently with our team to implement into the community for counseling and to work with social workers and to provide warmth. We're providing warming stations this winter. I know that last winter was my first winter into the community, so I really took notes of like what was needed and what we could fundraise for this year to provide. So we are going to provide warming stations that will have counselors on site, social workers on site, our team on site, distributing harm reduction and counseling and food and beverages and warmth and love. Those are important things. So
okay, well, thanks so much for joining us today. People know where to find you now. Hopefully we can garner some support for your cause.
Thank you.
And I guess we'll leave it there. Thanks so much. Everybody, if you got something out of today's episode, please give that like button a click. Every little engagement we get helps us get our message out further. Join us every Friday morning, every Sunday evening, or whenever you want on Apple Podcast. And that's it for now. We'll see you guys again. Take care.
Say, this is Hard Knox Talks.